Thank you. Good afternoon or morning, whatever the case may be, those that are in attendance for today's Pinnacle Health Informatics webinar on accessing legacy treatment data. So wherever you are, if you're in the Eastern time zone, it's 2 o'clock. It's noon here in the Mountain time zone, and it's 11 o'clock in the Pacific time zone. So we're excited that those who have attended are here, and those who aren't will record this and make it available. So please feel free to ask questions or to raise your hand if you want to know anything further, or if you'd like me to cover something else. So my name is Sean Fraser. I'm with Pinnacle Health Informatics. We do a lot of data management in the behavioral healthcare space. We do a lot of data warehousing and reporting and analytics. But one thing we're getting a lot more interest in is, what do I do with all my data when I go to a new electronic medical record? And we're in the middle of several of these situations right now. And the vendors can convert some of the data, but it's our experience that a lot of the legacy data they can't successfully convert. And you probably wouldn't want to, right? You need to have a clean new system as far as possible. And so but you may need to have access, and it's been our experience that we have clients that need to have access to that legacy data for years. So how do we make this easy? Well, there's a lot of difficult ways to do it that I've seen, but we've tried to come up with some ways that are easy and straightforward. So we were going to talk a little bit about that today. Let me just move on with the slideshow here. So access to legacy data is critical, right? You're going to get requests for that. You have a lot of information, and a lot of that just can't be imported into the new health record effectively. We have clients that we've done this kind of stuff for that it's been 7-8 years, and they're still on a daily basis having to look up records in their legacy data. And so, that for some age groups that can go on in perpetuity, so it can go on for a long time. So, but at least 7 or 8 years is my minimum for legacy data. And most people want to keep that longer if they can, just for analytics purposes and just to have those records. So it's very important. Another thing that's an issue is you may not have access to your legacy user interface, right? So you have your data, but you don't have the interface, right? You don't have the graphical user interface in which to interact with things. And so if you're not paying a license fee or something, then that goes away, or maybe it breaks and you're not paying support for it. So you still need to make use of that data, but you don't have access to the software. So in our experience, a data warehouse is essential for fast and easy retrieval. We can do so much more in a data warehouse. The native system is so normalized, it can be very slow and difficult to get data out of in many cases. But with the data warehouse, we can do all the kind of things we do to make it very fast and easy to keep that data alive, and it's just at your fingertips. The other thing that we do more and more is we're encouraging our clients that move to a new electronic health record to build links. If there's a way to build a link out of there to a URL or to an internet page, you can link directly from your new health record to your legacy data, which makes it even easier. And it makes it almost seamless for the end user. They can just link out and go to legacy data. And so we're going to show you a little bit about how that's done today. So let's move on here. So some examples of legacy data is crystal reports. Some of our clients have hundreds of crystal reports, and they need some way to access those crystal reports, but they don't have access to the user interface, like I said, but they still want to run those crystal reports and look at that legacy data. Well, we have some middleware that'll do that. SQL reporting services reports, same thing. We can give them access to those reports outside of the user interface on a client by client basis, all dynamic. We'll show some examples. Forms, a lot of people have legacy forms, assessments. signature forms, consent forms, all kinds of forms that they have created, and they need access to those, but they don't know how to get to it because they've lost access to the interface. Assessments, DLA 20s, any assessment that you might have in your system, that data will be stored in the data warehouse, and so we can get to it, and we can build interfaces that help you get to that information. Scanned attachments, a very big one. We have a client right now that the big vendor couldn't handle their scanned attachments, and they've tried to import them into their new EHR. It just didn't work. So we had that ready to go, and it's been working great for them. So it's a great way to get to their. And they have hundreds of thousands of these scanned attachments, everything from driver's licenses to signed forms, and all that metadata is in the data warehouse, and so we can link out to it. Treatment plan detail and components, that information can often be difficult and complicated. Well, we can help you get to that data as well. And you can have access to that, as well as progress notes. That's another big one. So you can have access to these sorts of things. And so we're going to look at this a little bit now. So this is just an example. This is just kind of getting into the weeds a little bit, but this is a NetSmart screen, and that you build a widget, right? So from NetSmart, you can build a widget that the user can be in NetSmart. So they've migrated their data, or they've migrated their agency to NetSmart, and they need to link out to their legacy data. So they'll build a widget. Incredible. It's you can build a URL string. Most of these systems have some way you can build some kind of a URL to get out. And if you can embed that, that client ID, then you can link out to these systems. So very important to learn what the capabilities are for your systems. So here's an example. So here we've linked out to a client report, and we've linked out from a client to one of our legacy Crystal, one of our legacy landing pages. And so this is what you'd see. So you'd link out by client ID, and you'd see here, oh, for this client, they have all these documents, right? They have a risk assessment. They have a service assessment. They have a Morse-Fall scale. And if you click on one of these, then you'll see a list of all the documents that they have. Some of them have just one or two. Some of them have 15 or 20 different documents, and they're arranged in date. So you can select one and run it, and you can click view, and another browser window will open, and you can see these various documents. So here's a face sheet, for example. If you click on face sheet, it'll come up dynamically the Crystal report for that client, and it will be the same Crystal report you're used to seeing, exactly perfectly formatted, the one you're used to seeing in your system, but it'll be outside the system. You don't have to go into the system to see that. And then you can do that with any Crystal report you've written. Like I said, some have hundreds, and they want to be able to run them all and see all that legacy data. They don't have to do thousands of PDFs. And I mean, we've had clients that have gotten proposals from people that, let's print out 5 million PDFs and catalog them. And it's just, that's not a good way to do it, we don't think. Just keep the data alive, keep the data hot, just run it. All this stuff's dynamic. It's in a format that people are used to seeing. Here's another client diagnosis summary. There's another Crystal report that somebody wanted access to. So it just comes out, looks exactly the same. You just click on one of these views, and the Crystal report appears. If it's an SSRS report, same thing. You just come out, and it looks just like it did when it was embedded in the electronic health record. This is this SSRS report that people like to run, and so now they still want access to it outside of the electronic health record. And there it is. Here's okay, forms and assessment. So that was Crystal reports and SQL reporting services reports. What if they have a form or assessment that they need to be able to access? Well, those can either be recreated in HTML or SQL reporting services or Power BI. Same thing. You can just click out and have access to that. All the data's there. You can pick a date, get access to all those forms and assessments that you're used to seeing. This is very, very common, very popular. And then you can print them, save them to a PDF, give them to a client, or give them their medical records for some sort of release, and make those useful. So forms and assessments, that's another item that's very difficult. You can't really import those into your new system, but if you're using a data warehouse, you can make use of those outside the system. Okay, so if we jump back again, let me just jump back real quick. My landing page. So one of these here is a client attached documents. So some of these clients have hundreds of thousands of, or some of these agencies have hundreds of thousands of attached documents. So how in the world are you going to give them access to those? So one way that we've done it is create a report in SQL reporting services, has all of their different attachments and attachment types. They come up on screen for that client. Just click view. They come up as a PDF. This is, you can tell it's a PDF here, but it just comes up as the original scanned PDF. Click on it and organized by date and everything. So again, we just had a client that's working with a large national big vendor, and they couldn't get their attachments. They couldn't migrate their attachments. So they're using our system, and it's working great. All their attachments are there. Okay, treatment plan, detail, and components. So if we look again at this landing page, let me go back real quick. So down here at the bottom, you see client history report. So for this client, you've linked out to this client from the EHR. There's a link to a client history report. And this is one popular way to see that data. So you can come in and sometimes you want to look for a different client, or you want to look for a date range of treatment plan detail and components, or you want to look for a birth date, or maybe you don't know the full name. You can just put like a part of their last name, and you can search for clients. So if it's been a while since that client's been in, but you still need to get their records, it's nice to be able to search by some of these things. Any of these fields can be left blank. You could just put in a a part of a first name, part of a last name, hit go, and then it helps you get that client information. And then this is kind of what would come up next. You'd have another version of the attachment report up here at the top. And then we have all the treatment plans and notes. We can look at all their treatment plans that occurred in that date range, all of the names. We can then look at any aspect of that. Again, there's the attachment report. We can look at the plan components. We can see their progress notes all the way back as far as you want to search. Very easy to see that data. Very fast because it's in the data warehouse. We build pre-built, pre-aggregated tables that are heavily indexed. We can even run these against in-memory data sources, so they're very, very fast. Here's if you expand out the treatment plan components, you can see all the components of that treatment plan, problem goals, objectives, everything. So, and it looks nice because you can run it right out and very fast, no waiting, and it feels kind of like it's part of the electronic medical record to a lot of these clinicians after they've been using it, so they can see all of these components and see the plan name. So that's kind of the summary of that. Let me go back here to the beginning. So we talked about crystal reports, SQL reporting services reports that you've built, forms, assessments, scanned attachments, treatment plan detail and components, and progress notes. And those are kind of the bulk of it. It's not really limited to this. You could do additional service information. You could do um, anything that's in the data warehouse, any form, anything else. We got a request yesterday for a new version for a release of information, and they need it out of their current EHR. They have to assemble a bunch of different reports, and it takes all day long. And they were like, could you just build one report and run it by client ID? Oh yeah, easy. That's easy to do. So your data can be freed, and you can have your data easily and use it out of the existing medical record if it's linkable. So with that, would anyone like to see anything additional, or have me go back over anything, or talk about any of the functionality or technology? Okay. Well, we're all about making your data useful and having access to it, regardless of it's your new data or your old data. We do a lot of blending of data. So a lot of our current clients, they came off system A to system B, but they still need reports that pull off both systems. And so we do a lot of that, and we're all about freeing the data, making the data easy to access, and avoiding disruption when you move between electronic health records. And so we wanted to kind of talk about that today because we've had a lot of requests lately for this kind of stuff. And so we wanted to show you a little bit about how that works. And we'd be happy to give you a live demo if anybody wants kind of a live demo. We could show you on a live system how that works. But we'll post this video, and if no one has any questions, we can go ahead and wrap up, and we can, if you're interested, feel free to shoot us an email or look us up on Facebook or LinkedIn. So thanks everyone for attending today, and we hope everyone enjoyed their time with us today. So thank you very much. And thanks, Olivia, for facilitating this webinar. So thank you very much.